This is a WDIO News Special Report.
Star and the number 1 on the telephone keypad. And please be advised that today's conference is being recorded. I would now like to hand the conference over to your speaker today, Mr. Michael Schomer. Sir, please go ahead.
Thanks for joining us for the COVID-19 media call for December 18th. We'll start today's call with comments from Health Commissioner Jan Malcolm and Infectious Disease Director Chris Earsman. After that, we'll open it up for questions. With that, we'll now turn it over to Commissioner Malcolm.
Thank you. Good afternoon, everyone. Well, the pace of growth in COVID-19 globally is not slowing down, adding another almost 750,000 cases in a single day around the world and over 13,000 additional deaths. And in the United States, as of this morning, we are definitely not seeing any sort of a slowdown in the nationwide surge, adding another 232,000 cases in a single day yesterday, and sadly another 3,280 Americans having died as reported yesterday. So we're now over 17.2 million cases in the U.S. and over 310,000 deaths. Here in Minnesota, we are seeing a more favorable trend we're happy to see. Minnesota reported 2,737 cases today on a volume of 63,994 lab tests. So we're now at a cumulative total of 391,889. I mentioned the global and national totals just because we've certainly seen in the past how what's going on around the country it does tend to have impacts as cases seem to move region to region. So it's just important, I think, that we bear in mind, even though our numbers are improving in some encouraging ways, we still remain above our high risk thresholds, as we keep talking about, and we just have to keep our eye on what's happening all around the country as well. Sadly, we had another 65 COVID-19 deaths reported to us yesterday that we are announcing today. So we are now at 4,723 deaths in total since the start of the pandemic from COVID-19. These were 25 deaths in the metropolitan area, 40 in greater Minnesota, in age ranges from people in their 40s and 50s up through their 90s. 36 of the deaths reported yesterday occurred in residents of long-term care facilities. There are 1,144 people currently in Minnesota hospitals with COVID-19, 270 in intensive care. The hospital beds in use for COVID decreased again yesterday, continuing the downward trend over the last week. 78 fewer beds in total, 19 fewer ICU beds, 59 fewer non-ICU or medical surgical beds. Cases have been stable for the last few days, and now we've seen 4 days with case counts below 3,000. The weekly change in cases, so the rate of growth week over week, is half of what it was the prior week. It's 5.6% currently, down from 10.1% the week prior. The population-based measure of case growth that we talk about continues to fall. It's now 63 new cases per day per 100,000 people. Well, while really being pleased to see that this is just about half of where it was at the top of the last peak earlier in November, it's still quite far above the state and national high-risk threshold of 10 new cases per day per 100,000 people. The 7-day average testing positivity rate is 9.7%, bringing us down below the high-risk threshold of 10% for the first time in quite a while. Now, these are positive signs, but again, there's still a lot of virus circulating in our communities, and as we head into the end-of-year holidays, it's just really critical that we keep our guard up, we recognize that we're still in a high-risk situation, and keep maintaining those important preventive measures. And with that, I would ask Chris to give us an update on the vaccine situation.
Thank you, Commissioner. there is an incredible level of interest in vaccines, and that's a great sign that people are recognizing how essential these vaccines will be to getting us out of this pandemic. We've said for some time now that what's needed at this stage is a mix of hope and patience, and this week's vaccine news items show this very clearly. On the hope side, the ACIP will be reviewing the Moderna vaccine and making recommendations. The VRBPAC has reviewed the Moderna vaccine and approved it, and we expect that the FDA will be making an announcement very soon. This will be the second vaccine that has been approved as safe and effective, and Moderna's vaccine has been shown to be a remarkable 94% effective in preventing COVID-19 illness. The ACIP recommendations, as I said, are expected this weekend, and the EUA from the FDA should be coming out as well. And Moderna vaccine could begin shipping out next week. We're hearing from the feds that we will have access to 94,900 doses for Minnesota in the first shipments of this vaccine. The primary focus for these doses is vaccination of staff and residents in skilled nursing facilities across the state. That brings us to the patients part I mentioned. Minnesota is currently in the process of receiving our first allotment of the 46,800 doses of Pfizer vaccine as planned, and we expect that those shipments will be done today. All 25 hub locations in the state are expected to have received their shipments by the end of the day, and they will be sending out to their spokes when they are ready to vaccinate. And some hub sites have already begun vaccinating, which is really exciting. As of today, we have heard that 947 healthcare workers have been vaccinated. Unfortunately, there is still a very small amount of Pfizer vaccine available, and so many people who want and need to be vaccinated. So we have more demand than we have supply. States and communities are depending on the federal government to provide the vaccines and updates of how much we can expect to receive. Minnesota was among those states recently informed by the federal government that it will receive less vaccine than we were initially planning for in the second shipment of Pfizer coming into the state next week. We will receive 33,150 doses in that allotment. Pfizer has said the lesser amounts are due to manufacturing fluctuations. Governor Walz has made it clear that we are committed to transparency, and to make it easier for Minnesotans to keep track of the vaccine supply coming into the state from the federal government, we're adding a new web page on our website showing the latest numbers that we will be receiving from the feds. The shipments that come into Minnesota are being allocated according to the approach we've discussed before. We know that there's great interest in vaccines, and as a quick reminder of this process, the federal government tells us what we're allocated as a state. We indicate how best to distribute that to the regions, and then the federal government ships it through their systems directly to the vaccine providers. We're excited to get more product from Pfizer and Moderna in the weeks to come. And keep in mind that there are even more vaccines at various stages of trial and review. We'll keep sharing updates with you as we learn more, and we will continue to do our best to strike that balance of hope and patience. One other vaccine-related update we wanted to discuss briefly has to do with the amount of vaccine within the Pfizer vials. As you may have seen in media reports, some vials of the Pfizer vaccine have extra product in them after the 5 doses are taken. The U.S. Food and Drug Administration is aware of the issue and working with Pfizer to determine the best path forward. MDH has informed providers that we will share information with them once we have written guidance from the FDA. It's important to understand that FDA is the authorizing entity, and MDH does not have a role in either authorizing or not authorizing the use of extra doses. The federal government has not publicly announced the guidance on this topic, but has indicated, the FDA has indicated in statements to the media that it is advising that it is acceptable to use every full dose obtainable. While we wait for written guidance from the FDA, our best recommendation for healthcare providers is to rely on their own internal guidance and protocols as they apply in this context. And with that, I will turn it back to Mike Schomer.
Thanks, Chris. Operator, we're ready to take questions.
Thank you. As a reminder, to ask a question, you will need to press star then the number 1 on the telephone keypad. To withdraw your question, press the pound key. Your first question comes from the line of Jeremy Olson from Star Tribune. Your line is now open. You may ask your question. Again, Jeremy Olson, you may ask your question.
Yes, can you hear me? Hello? We can hear you now, Jeremy.
Yes,
we can hear you now.
Okay, sorry about that. Yeah, I was just asking, with respect to bars and restaurants remaining closed, things are improving so much. Are we sure this isn't overly heavy-handed? What's to fear if we opened up bars and restaurants right now? What would be the consequence of that?
Well, this is Jan. I'll start, and Chris can share additional data if that's pertinent. Again, I just would kind of restate, while these trends really are encouraging, in no way are we trying to underplay that. It's a very significant drop in the rate of case growth. We're still really high, far above our high-risk thresholds. And we know from, kind of looking back on what happened when we hit that exponential growth phase, and we know this from all kinds of other data nationally and internationally as well, that when you get to, I keep mentioning this, per population case growth rate, the high risk threshold considered to be at 10 new cases per 100,000 persons a day. And when we got to about 15 to 20 new cases per 10,000 a day, that's when we really kind of tipped and went into that exponential growth. And Dr. Birx had been warning us about that, based on what she had seen in other regions, that we were, when our numbers are that high, it just can change so very quickly. So it's really, that's the context in which we think about how safe is it to open up environments that we just plain know are riskier, through, again, as we keep saying, through no fault of their own. It's not about failure to take precautions. There's just some inherent risk in some environments like that. So that's really the context for just wanting to keep on watching these trends. We know also that we need to see 2 solid weeks of this kind of decline in order to make sure that's really a valid decline, and it isn't just an artifact of numbers being slow to come in. So just a lot of factors go into that, and we know that we may sound extremely cautious, but I think that's because experience has taught us that it's wise to really look at this data over a period of time and to be mindful of where that tipping point appears to be.
A follow-up question. It seems like one of the gaps in the arguments, it has to do with the issue of secondary transmission, because the bar owners will say that only 2% of cases have been tied to bar outbreaks. And then you'll say, yeah, but what we're really concerned about is not just those primary infections, but the secondary ones. But that's where we seem to have a lack of data, unless I'm just not seeing it. How do you know there is secondary transmissions emanating from these group settings? And can you share any of that proof or data?
Chris, could you help on that one?
Yep. Well, Jeremy, a couple of things. If we didn't know that there was secondary and tertiary transmission, if there wasn't, we wouldn't have a pandemic. So, it's obviously very necessary to continue the spread of disease in a pandemic. And while we don't have the staff capacity to follow up on every single outbreak that we see in a bar and restaurant to be able to trace the secondary and tertiary transmission, we do know from an example like the Sturgis gathering over the summer that when we had a very distinctive event like that, where we were able to, on a more focused basis, look at, okay, we saw this many cases that reported that they had actually attended the event, and then we were able to follow up looking at secondary and tertiary transmission. We obviously saw very clear evidence of that. And so the virus, the way the virus is transmitted doesn't change whether you attended Sturgis or you were at a bar or a restaurant. And so we extrapolate based on that experience. But you're right, we don't have the capacity. We have over 500 establishments that have had, outbreaks identified. And so we don't have the capacity to do, secondary and tertiary follow-up in every one of those situations. But we do know that, one, that's what's necessary to drive a pandemic, and two, in the situations in which we have done specific follow-up, we have seen evidence of that transmission. And I should say also that that's been seen nationally as well. So again, the wedding in Maine, not a bar and restaurant, but the same type of thing. And, the follow-up shows clear evidence of extended transmission from a single event.
Thank you.
Thank you. Next question comes from the line of Bill Werner from Minnesota News Network. Your line is now open. You may ask your question.
Thank you, and thank you for taking the question. Commissioner, I think this one may be for you, and it may not be 100% fair, because I know that you clearly don't support businesses who are violating the governor's order, and you are not encouraging people to patronize businesses that are violating the governor's order. But we have all seen videos of folks in various locations packed into bars without masks. I guess the question comes right out of this: if they're wearing masks and trying to keep some distance, does that help at all? And I know you're not going to encourage them to do that, but give us kind of a reality check on that, if you will. Can in those situations, can there be any sort of mitigation that's involved and still let people, get their yayas out on the holidays?
Well, I'll ask Chris to comment on the benefits of mitigation, even in a situation that isn't recommended. But I would take the opportunity to just reiterate something that the governor has said often, and that is that we surely appreciate the frustration that the businesses have. And again, it's just unfortunate that the very nature of the business creates a high-risk environment for the transmission of this particular virus, and that we think it's critical that those businesses who comply, and the great majority of them are complying with the governor's executive orders, and out of fairness to them, and we believe it's critical that we enforce the executive orders even in an even-handed way, but that these businesses get economic relief. And we're heartened by what sounds like progress at the federal level. We're grateful that the legislature took a positive step. So there's no dispute from us that these businesses deserve economic support to be doing things that are in the public interest. It's just regrettable that it gets down to kind of pitting business survival against what we continue to believe is a well-established risk to additional spread of the virus. So we're hopeful that economic relief will be forthcoming and will help to support these important businesses. Chris, anything you'd add on mask wearing in bars?
Yeah, if I may, before you do, Chris, let me frame my question a little bit differently. Is there, in situations like what we're talking about, in other words, bars and restaurants who happen to be violating the governor's order, you got a lot of people in a limited space. Do any of these mitigation methods like masking and social distancing, if they were to be observed, would they help at all in terms of reducing spread?
Sure. Well, I mean, certainly, if you were able to social distance and mask, that would be better. But I really feel that these are very unsafe situations, and so I'm really uncomfortable saying, "Oh, well, do this to make it better," just because it's really not safe. And I'm going to share something that, I learned after. I think you may have recalled before deer hunting season, we had mentioned it was important that as you were deer hunting, that it's really important that you're taking precautions to stay safe and to make sure that you're socially distancing and all of this. And I got an email from a friend who said, I remember you saying that, and my cousin went hunting with a friend, and they had a guest from the cities who was infected. The friend's mom, who was 80, cooked. The friend's mom passed away, and my cousin just passed away, and I sure wish they had listened to what you had said. And I think sometimes, we get so caught up in the data and we get so caught up in the big picture that we forget the stories of people. And so I'm reluctant to go against the guidance that we've provided, because I would surely hate to have another story like that take place. So just putting that out there just as a sobering reminder that this is a serious disease, and we have to take it seriously.
Thank you both.
Thank you. Next question comes from the line of Dave Orick from Pioneer Press. Your line is now open. You may ask your question.
Thank you. I want to talk about vaccines. Chris, you said that the second allotment was down to, you gave the numbers 30,000 or some, it's previous in my notes. What had it been beforehand? And then I'll have a follow-up after that.
Sure. Well, I want to be clear that, the federal government is giving projections of what we might get, and that's very variable, and that's partly why we've been, hesitant to provide numbers, just because they change so much. The number was in the 50,000. I don't recall it right off the top of my head. Let's see if I can find it. So the projected number was 58,000, and we're getting 33,150. But I do want to acknowledge that things are changing, and so those projections, we've been told that they can change rapidly, and that's why we want the public to recognize that when things do change, that's not unexpected, because, this is just an incredibly fast-moving situation. I have to say that I have to keep reminding myself that Monday was only 5 days ago, because it certainly feels like it was a year in terms of all the things that have happened. So I think it's important that the public realize that, we want them to know what we're hearing. We want to be transparent, but we also recognize that these numbers are changing very rapidly, and so the public has to recognize that is happening.
Okay, got it. Now, the total number of Pfizer vaccines that we're going to get in some relatively near term, I don't want us to get hung up on second shipment versus third shipment and some subcategory. Is the total number of Pfizer vaccines that we're going to get in some relatively near term, has that number changed, or is it just a question of when we're getting them?
I think it depends on how you would interpret it. Right now, we expect that when the orders for next week come in, we will have received 79,950 Pfizer doses. And so, what would we be expecting? That's based on some of the projections that we received. The bottom line is that we're receiving close to 80,000 doses, and our goal is to get those doses out and make sure that they're available so people can be vaccinated as quickly as possible.
Okay, I'm sorry. This is just final follow-up on the same point. Again, is this just hiccups in when we're getting this stuff, or is the total amount of Pfizer vaccine changing?
Well, to be clear, the federal government hasn't said, in Minnesota you will receive X number of Pfizer doses in total. And so, now they've said we're going to receive less than that. They're giving us weekly projections of what we can expect to get. And the projection this week, the allocation this week was less than one of the earlier projections, but we don't have a projection for what the week after or the week after will be.
Okay, thank you. That's what I was looking for. Thank you very much.
Sure.
Thank you. Next question comes from the line of John Croman from Cary. Your line is now open. You may ask your question.
Hello. I think Mr. Orrick got to all the questions I was going to ask about the vaccine. But the other question that we've heard a lot lately is, if I have antibodies because I've either received the vaccine or have had the disease, had the virus and recovered, can I still transmit it to other people? Can it still be brewing in my body to the point where I can infect other people, even though I no longer can contract it myself?
Chris, would you take that?
Yeah. So that's it's a little bit of a complicated answer. Certainly, if you had the disease, CDC is saying that for 90 days after you had COVID disease, you wouldn't need to re-quarantine. So I guess the message there is you have 90 days in which we're considering that you would not be a risk of transmitting to others. When it comes to the vaccine, a couple things I want to be very clear. Individuals who are vaccinated, the type of vaccine this is, they cannot shed anything. They cannot, there's no shedding of COVID from this vaccine. So I want to be very clear about that from the get-go. It's just not possible because of the nature of the vaccine. But the technical thing here is that the clinical trials that were done use COVID disease as the endpoint. And so that's what they use to determine how effective the vaccine is. And so when it comes to asymptomatic infection, they don't have data on that. And so we cannot comment on the role that the vaccine will have in preventing asymptomatic infection. Now, certainly from just a logical biologic standpoint, you'd think, well, if it prevents clinical disease, wouldn't you expect it to prevent asymptomatic infection? But the bottom line is we don't have data to be able to speak to that. And so because of that, we have said that even after people have been vaccinated, they still need to follow the mitigation strategies. And for healthcare workers, they still need to wear personal protective equipment. And we're expecting to get more data on this in the weeks and months ahead. And as more and more of the population becomes vaccinated, that will make a difference. But right now, even people who've been vaccinated need to continue with the mitigation strategies because we're lacking data on that particular point. So just to reiterate, with antibodies, with natural disease, you've got 90-day window, is what CDC is telling us. I want to be clear that the vaccine, a person who's been vaccinated they're not shedding anything, they can't transmit anything. And then when it comes to, asymptomatic infection, we just don't have the data because that was not an endpoint of the study, and so we can't comment on that. And so we need to get more data, and we need to be cautious going forward until we have that data.
So keep masking up, essentially.
Yep, keep masking up, keep socially distancing, keep engaging in those mitigation measures for the next number of months.
Operator, we have time for one more question.
All right, thank you. We have the next question comes from the line of Catherine Richard from Minnesota Public Radio. Your line is now open. You may ask your question.
Chris, one quick clarifying question, and then I have a follow-up. Is the practical impact of not getting as many Pfizer vaccines as you expect next week, that this whole process will just be that much slower? I'm just trying to get a sense of what the big picture is here.
Certainly. And I do apologize. They're putting gutters on my house, and if there's a background noise. So the challenge is that we can only move forward when we have vaccine. And so, we've talked about phase 1A, and that's our healthcare workers and our long-term care residents, and we want to get these folks vaccinated, but we can only vaccinate when we have vaccine. So, as the vaccine comes in, we're making sure that it gets out, but when we get less vaccine than we were hoping, that just means it will take us longer to vaccinate the key personnel in the first stage before we can move on to the second stage. So yes, it does make a difference in that regard. But as I said, we didn't receive, the 6-week projection from the federal government saying this is what you're going to get. We're getting these allocations on a week-by-week basis.
So my follow-up question is this: can you explain in a little more detail how the state is allocating doses to specific regions of the state, particularly those areas where we see a lot of healthcare workers? And can you address specific concerns I'm hearing around here in Rochester, around Mayo, that they are not getting enough vaccine to cover the first, roughly 11,000 frontline workers that they have identified as being eligible for those first vaccines? Their concern being that this could go well into the spring if the allocations continue such as they are.
Yep. So that's a very valid question. So a couple of things. The federal government is doing a pro rata allocation to states, but it is not purely pro rata. They ensure that every state receives something. If they were just doing a pure pro rata allocation by healthcare workers, probably New York and California would get most of the vaccine. So they're making sure that each state receives vaccine, and we're doing the same in Minnesota. We're making sure that each region of our state receives vaccine. So it's not purely pro rata. It's pro rata within the region and their needs, but we do ensure that every region receives vaccine. And then I think we talked about the fact that 85% of the vaccine that we receive is purely pro rata based on the needs of that region. And then 15% is allocated based on the social vulnerability index, which means that we look at what proportion of a population in a region falls into the highest quartile of social vulnerability. And then that helps to, dictate the last 15% of the allocation. I want to be clear, however, that while we're using the social vulnerability index, all of the doses are allocated for healthcare workers and long-term care residents at this point. So just to be clear, the social vulnerability index helps to ensure health equity, but the doses in the first phase are all for healthcare workers. The way that we have determined the number of healthcare workers is we're using the American Community Survey. It's based on the census. It's what all the states are using to determine the allocations for healthcare workers. So it's being used across the country, and it's the data that we have gotten from CDC. And we certainly have been made aware of the concerns that Mayo has expressed, and we're having conversations. But I can tell you that what we've heard from, the rest of the state has been that no one is getting as much vaccine as they need. But we have not heard concerns that the survey data seems to be wrong in other areas. And we've not heard that from other parts of the country, but that's the data that we're currently using.
So just to be clear, there might be, oh, sorry, go ahead, Commissioner.
Oh, go ahead and ask your question. I was just going to make a further comment, but go ahead.
I just want to make sure I'm understanding correctly. So what this may be, from your perspective, Chris, is a mismatch of the how those essential work or those frontline workers are being determined. You have one number, Mayo may be using a different number, but you're going on the numbers that the rest of the country and the rest of the state are following, essentially.
Right, and I'll just add one thing before I turn it back over to the Commissioner, and that is just that we need to have a system that we can use statewide for allocating. That is, is the same statewide and allows us to allocate on a statewide basis. So that's one of the advantages of the system. But with that, I'll turn it back to Commissioner.
Yeah, thanks. I just was going to say a little bit to Catherine's follow-up question or point that, we surely agree with all the providers that want to vaccinate all the frontline healthcare workers, absolutely. But the challenge in these first weeks is just going to be how great is the supply and how deep into that prioritization can we get, how fast. And I think, the initial doses, and it's really important to remind people, as Chris said, it's in the earlier phases of the planning, the expectation was this first phase, 1A, as we keep talking about, was only going to be healthcare workers. It was fairly late in the game, quite late in the game, that the federal framework added long-term care residents into that same 1A priority. So we're having to share the pie, with a broader population, rightly so, we believe, just given the importance of the vulnerability of those populations. And then within that phase 1A, we've got tiers of priorities, and it could be, I don't know this for sure, that some of the numbers that Mayo is using are that broader group of workers that do fit within 1A but may not be in the first priority category. But the fundamental problem, as Chris has said, is just that the supply is so limited that nobody's getting as much as they want to vaccinate their workers as quickly as they want, and that's a problem we all share. So we're just hopeful that the volume supply will stabilize and improve and build in these next few weeks.
But let's celebrate the fact that 947 healthcare workers have already been vaccinated with their first dose. I think that's really a number worth pointing out and being excited about.
All right, that is all the time we have for this afternoon. Any reporters with additional questions are welcome to reach out to our office this afternoon. Have a good day, and we will be back with you again soon.
This has been a WDIO News Special Report.